the best online education at the most affordable school fees? Enroll now at Jose Maria College. Jose Maria College, under the leadership of its founding president, Pastor Apollo C. Kibuloy, holds true to its mission of providing an assured, consistent, and quality education amidst the ongoing crisis on COVID-19. To ensure that all students will get the best learning experience, JMC provides an assured education with the most flexible learning delivery choices. To highlight the learner's wit and abilities, JMC is consistent in providing the best learning exposures with a student-centered showcase of extracurricular activities. Amidst the challenges of the new normal, JMC guarantees that quality education is not compromised through our learner-centered curriculum, highly trained and dynamic faculties, and state-of-the-art facilities designed to deliver the best learning experience to our students. We are proud to say that JMC is fully equipped for new normal education. What are you waiting for? Enroll now! Scan the QR code on your screen for more details. Your future is our mission. Enroll now!
The world is falling apart. Every day is breaking our heart. What happened to the world? If we're all lost, what happened to the place we call home? Let's fight their sons and me. Let's be one, you and me with unity. No matter what pain, no matter what strife, we can make it through with God on our side. So little battle we can win. Everyone will be beneath his wings. If we work together, make the choices matter. We'll all be free from adversity. If we're alone, what happened to the place we go home? This is our world, our
coronavirus killed
The number of
more than
people who
200,000.
contracted the
I can't say it
coronavirus
enough.
continues to grow.
Enough
More than
people have
1,600
died. We don't need
Americans
any more
are
deaths
infected.
like crazy.
The virus has come knocking at China's
Fighting the
number
coronavirus
of
Spent weeks minimizing what is clearly a very serious problem. No doubt these people have good intentions.
I think the pandemic has reminded us how we do not have enough doctors in the right specialties and in the right places. Since the beginning of the pandemic, if you would try to remember, doctors have been working round the clock in order to save the lives of people. And in the process, also of doing this one, many dedicated doctors succumb to the deadly virus. And we know all that one in many news that we have seen. We also see hospitals overflowing with patients, understaffed, but then the battle continues. This in itself is a manifestation that the growing need for doctors in every corners of the world remain to become a reality and at the same time a problem. The path to a significant curricular reform is a difficult thing because of a variety of factors, to include the challenge of physical distancing, since we all know practice-based learning is the backbone of education, especially among doctors. We need to see patients. We need to harness our skills, knowledge, and attitude by looking at patients, okay, so that this would be able to enhance or forge our professional identity and develop an orientation to a patient-focused based care that would shape the practice of future medical doctors. We wanted to produce doctors with a heart. And our goal is also to define a unique characteristic that will be anchored to the local needs and national health needs of the people of Mindanao. I believe looking at the vision mission of the college and influenced by the universal healthcare law, I think we seek to envision and integrate a comprehensive approach that will be cost-effective, promotive, and preventive, as well as curative, palliative, and rehabilitative, one that would encompass the entire domain of the individuals and the population, particularly here in Mindanao. For we are trying to be committed in producing medical doctors imbued with a heart to serve and is willing to contribute for nation building in our country. And I think this is always a possible. This is always our strategic plan to set apart GMC as a college of medicine. We wanted to create doctors with a heart. We are very lucky. We have our own LMS, the Learning Management System, powered by Huawei. This is the first in the Philippines. Everything is there in terms of lectures, in terms of resources for learning. And I think our new generation could adapt of it because these are the computer-based population. The COVID-19 has resulted in schools shut down all across the world. And education has changed with the distinctive rise in the new method of learning. And I think adaptability and ingenuity were the two core values that we have learned from this experience. Dream big. They have to dream big. Dare to dream. As long as you have the dedication, you have the passion of becoming good doctors in the future, we welcome you to the College of JMC, especially in the Department of Medicine.
Good day, fellow J Marians. Check your ticking clock. It's 6 in the evening. And do you know what time is it? It's hashtag MedTech Hour. Welcome to your Wednesday habit. This is once again MedTech Hour, a show where we delve into the technologies that diagnose, treat, and improve one's person's health and well-being. In this episode, we will be talking about MLS or medical laboratory science as the foundation of diagnostic medicine and its role in containing any pandemic. Uh, Treating that as critical since an effective and timely response is necessary for any outbreak such as this that what we are experiencing now, the COVID-19 pandemic. And on that note, we have of course invited with us our isa sa ating suki na speaker sa ating MedTech Hour program, a faculty from the MedTech program of Jose Maria College Foundation Incorporated. But before I bring him here in our room, I'd like to first do a quick shout out muna sa ating MedTech Hour friends joining us live on Facebook and YouTube. We have Ma'am Lerio Entanto. Ayan, good afternoon po and thank you so much for joining us. And Patricia Clark. Ayun. Hindi ko nakita yung name niya kanina. All right, there you have it. And yeah, without further ado, I'd like to introduce to you our speaker this afternoon, who's going to be joining us for 1 hour from 6 to 7, and our healthy discussion on MLS. Please give it up for Mr. Ray or Sir Ray Gomez. Ayan, Sir Ray, good afternoon and welcome to the show.
Hi, good afternoon, Sir Vince. Good PM. Good evening na pala.
Yep. How have you been? Kumusta po, Sir Ray? It's been quite some time since we last had you in the show.
Yeah, everything's good. Busy.
All right, all good. Good to hear that. This afternoon, pag-uusapan natin na based sa sinabi ko kanina, ito ata yung ano eh. I believe this is a series, right? For this afternoon, you'll be the one to speak, and then next week it's going to be Bea Lau who will do the continuation of the topic. Can you like tell us in a nutshell why is this so important and so significant to be discussed, especially now we are in a pandemic such as this?
So for this evening, we are going to talk about the role of medical laboratory scientists in this in the battle against the pandemic, because while doctors and nurses are so visible at the front lines and are being they are being applauded in their role in the recovery of hundreds of thousands of COVID-19 patients, the world knows so little about those people who are behind their successes. So which are one of those is your medical laboratory scientist or MLS or medtechs. So this is important, sir, because the medical laboratory profession is a bedrock of diagnostic medicine, and the role of medical laboratory scientist is very crucial or is very important in containing any pandemic. So, example for that is an effective and very timely diagnostic approach is important or fundamental and very appropriate for the containment of any outbreak. And the MLS or the laboratory scientist is at the forefront of that.
Ayun. So so basically ito yung MLS, ito yung frontliner na sinasabi mo in in the battle against pandemic such as this. Now, can we give our audience a quick run through as to what is contained in our talk this afternoon? Can we show them the outline perhaps?
Okay, wait. Okay, for this evening, we are going to talk about first a brief history of COVID-19 pandemic, and then a brief discussion on the etiology or where did the pandemic come from. We are also going to talk about the transmission of the virus, and then what is a medical laboratory scientist, and what is the role or what are the roles of medical laboratory scientists in COVID-19 pandemic?
Nice. So good.
All right, so we're gonna have a quick look back as to how it all started and how it spread globally. So yeah, shall we begin? Yes, sorry, saan ba ito nanggaling? Basically, kasi may mga meets and mga usap-usapan ano na I think we really have to clear the air kung saan ba talaga ito nanggaling sa bat ba ito, sa unggoy ba ito? 'Di ba kasi common kasi yun na mga usapan eh.
Yes, Sir Vince. The COVID-19 actually began. The first report began on December 31, 2019, when the WHO or World Health Organization has received a report about the occurrence of several cases of unusual pneumonia among people who had either visited or had consumed food from the live animal market in Wuhan City. So on January 7, 2020, the year after, the WHO announced they had actually identified the virus and named the virus nCoV 2019. So also na-identify nila na yung virus that causes this weird pneumonia belongs in the family of Coronaviridae. Later on, we'll discuss about that. And then on January 30, WHO declared a global health emergency of international concern because the death toll in China jumped to 170. And during that time also, China's already 7.7 thousand cases. So that's already concerning. On February 11, the WHO, the body, eventually changed the name of the virus to COVID-19. And ngayon nga, I think they changed it to SARS-CoV-2. And on March 11, 2020, WHO declared the occurrence as a pandemic because it's still continually spreading across the globe.
All right, sir, hold on. You mentioned earlier, can we get back to it? Na it's already alarming given that there were approximately 7,000 cases in China. When do we say, or what is the what is the parameter so that a certain organization such as WHO or World Health Organization can declare that a phenomenon is a pandemic? Ano ba yung parang basehan siguro nila, sir, or any basis para sabihin natin na, or so that it's sufficient for us to say that a phenomenon is pandemic already?
I think, sir, WHO, I mean, I'm not sure, pero this is what I think. When the infection has spread not only to neighboring countries but also to the countries afar, so that will be the time that they consider it as a pandemic. Because pandemic basically means that it's a worldwide na event.
I see, cool. So
Spread worldwide already.
all right, I see. So pag nag-spread na siya hindi lang sa neighboring countries and even sa countries afar, yun na, that's how that's when we declare the pandemic. Oo nga naman. Kasi nga pandemic. Okay, yeah, anyway, now moving forward. You mentioned also earlier yung etiology. It's a new terminology for me. I don't know if that is a medical technology jargon or what, but basically, ano ba yung etiology of?
Okay, sir, etiology is the origin, so the cause of a disease, ganun. So
I see, ayun. So parang yes,
So
go ahead. Parang etymology.
parang ganun po, but in science, siguro. So the etiology of the pandemic, as I've mentioned earlier, when WHO identified the virus, they identified it as a new strain. That's why it's called novel, because wala pa, di siya, or it's unprecedented. So it was named as nCoV-19 initially, and then changed it later to COVID-19. So the virus has said to be an envelope. So pag sinabi tang envelope, sir, may coating yung virus. It has a single-stranded RNA. So there are two types of viruses. We have the DNA and RNA. So it's identified as a single-stranded RNA, and it belongs in the Coronaviridae family. So Coronaviridae viruses include your SARS and your MERS. So itong nag-outbreak sa una. So SARS, severe acute respiratory syndrome, and MERS. So this type of virus sa COVID, it belongs to the same family. Now, when the virus is examined under an electron microscope, it appears like a crown. That's why it's named as coronavirus. So basically, that's the shallow discussion on what is what the virus is, what the COVID-19 virus is.
So basically kasi tinawag na corona kasi crown. Parang ganun.
Yes, sir.
I
Yes, sir.
think naman, yeah, they have sometimes they have a peculiar way of naming things, especially sa science, Sometimes kasi it's after a name of a person. In this case, parang sa figure naman niya,
Yeah, sir.
which is, yeah, I think a perfect terminology for it.
That's actually
Okay.
how scientists name stuff. Like if siya yung naka-discover, the scientist is named, or the discovery is named after the scientist. Or pag hindi naman, the discovered is named after a structure, the description of the structure and all.
Sige, ganun pala yun. All right. Sige, eto sir, ano ba to? Is this like mga parts niya or ano ba to?
Oh yes, sir. Oh, it's basically the characteristic of the virus. So it can envelope.
Characteristics. Okay.
It's a single-stranded. It's a scientific science people ang makarelate most probably.
All right. Sige. Okay, now so let's talk about the transmission of COVID-19 virus, kasi I believe over time paiba-iba yung nag-evolve yung ways of transmitting the virus. Dala na rin siguro ng paiba-iba ng variants. Can you give us a rundown kung ano ba yung mga different means and ways of the transmission of the COVID-19 virus?
So, although, sir, the first cases of COVID really happened in Wuhan City. So it was linked to consumption of seafood, animals, as well as bats and snakes. So yung sabi mo kanina, so the initial transmission of infection was due to the consumption of live animals such as your bats and snakes. Pero the spread of the virus really is due to person-to-person na contact. So this is due to, because the virus is spread in droplets. So these droplets are released from the nose and mouth of an infected person when they sneeze or cough. So actually, a single cough can release about 3,000 droplets. So imagine if yung droplet it contains the viral particle, though the person na nakatake in ng particle really would be infected. So that's why very fast din ang transmission ng virus.
All right, sige, ganun. Okay. So we have here droplets, airborne. So aside sa person to person, meron ding airborne.
When we say airborne, sir, kotahay, or for example, a person sneezes and coughs. So the virus studies have showed that the virus can remain in the air for up to 8 hours. So basically, even though na wala na ka sa area, or you're not in close contact with someone who actually produce those droplets.
Mm-hmm.
Because the virus can thrive in the air for 8 hours, you can still get or take in the droplets.
Oh, I see. So it could still remain there. I see. Ganun pala yun. Now, sige. For ano, meron sa air, meron ding ano to sa letter C we
Firstly,
have
oh,
ano to, it is through
so
through handshake.
So, virus, sir, can also be spread through people's clothing and surfaces when the viral particle had been discharged from an infected person and falls on the surface. So, studies have shown that the virus is capable of surviving for a varied period of time depending on the surface. So, for example, in human
Mm-hmm.
hands, it can survive for 8 hours. So, pag wala ka nag-hand wash, wala kay proper hand hygiene, the virus can thrive there. For paper, 3 to 4 hours. For copper, 4 hours. So I'd like to emphasize the paper and copper, sir, because our money, yung money natin, are made up of paper and copper. So basically, if hindi na sanitize yung money, it can actually be used as, or it can be a vehicle for the transmission of the virus.
Yep, that's one great reason we encourage anong tawag diyan, paper no, contactless payment or yung mga electronic na lang na cash. 'Di ba? Ang dami na ngayong 'di ba? Kompleto na ata PayPal, GCash, PayMaya. And
Yes,
all
sir.
that, scan QR code na lang ngayon, mabilis na lang And yeah, sir, paano yung those who do not have paper bill or the coins, ATM. Sa ATM, pwede rin siyang mag-thrive doon.
Yes, the best thing they could do, sir, if they are handling money, is that really from time to time disinfect. Siguro the hands na lang, that the ones na pwede ma-disinfect, because you hold the money with your hands. So from time to time you wash your hands after holding a money, so that you could eliminate or at least reduce the chances na may virus na nag-thrive doon.
I see, yun pala yun. All right, now we also have here fabrics, metal surfaces, plastic and stainless steel. Up to 72 hours?
Yes,
Why is that so? Ano ba yung what's with metal, or should I say plastic and stainless steel, na matagal mag-thrive yung virus sa kanila?
I think it's really on the material of the plastic and stainless steel na uh, that wouldn't kill the virus naturally. Sir, kaya nagta-thrive sila doon.
Kaya siguro I don't know if this is something to do with the with COVID. Pero there are fast food chains na they do not anymore have the yung mga plastic na mga uh, utensils na binibigay. I don't know if nag-order ka ng sira sa mga fast food, but lately kasi recently I ordered, at saka yung mga nila, I find it weird yung yung mga spoon and fork nila is parang ba yun? Parang murag cartoon na good sir. Parang, at saka they also have like yung parang made of kahoy na mga kutsara. I don't know if it has something to do with COVID pero I think that's a great measure para siguro ma-lessen yung I don't know really. baka
Actually,
lang may link yun.
yeah, I think it has something to do. It has something to do with that na pagka-release nitong study na to. And also it's more the use of the use of wooden and yung paper. It's like it's more uh healthier in terms of the nature, the environmental in the environmental aspect, kasi nade-degrade yun. So I think that's why restaurants right now are adapting to that kind of setup na.
Yeah, so parang multi-purpose na siya. It serves a lot of purposes at the same time. Okay. Eto sir, ano ba yung parang ano, if you were to liken the role of MLS or those who are in the medical technology field, ano ba yung parang role nila if you were to liken that to ano, to any siguro job or si ganun, or saan ba papasok si ano, si MLS pagdating na ng ano, pagdating na sa ganitong mga scenario or situations?
So before we proceed to that, the role of the medical laboratory scientists in this pandemic, let's discuss first what is a medical laboratory scientist. So a med lab sci, MLS ang tawag, or medtech or clinical laboratory scientist, or here in the Philippines mas common ang medtech, uh, is a vital healthcare detective uncovering and providing laboratory information from laboratory analysis that assist physicians in patient care. So these health professionals use different biomedical instrumentation, technology, computers, and methods involving manual dexterity to perform laboratory testing on clinical specimen, such as your blood, urine, feces, semen, and all, and tissues like that. So the laboratory testing encompasses disciplines such as your clinical chemistry. We say clinical chemistry, dyan under yung glucose levels and other chemicals in your body that can be found and measured in your body. Medical microbiology is the discipline where you study about microbes, so bacteria, fungi, viruses. Hematology, dyan under yung CBC nyo, about the blood. Immunology and serology, under dyan yung immunologic reactions in your body. Histopathology is for the tissues, the organs in the body, and molecular biology. So medical laboratory scientists are expected to generate accurate laboratory data that are needed to aid in detecting infectious pathogens. They also monitor testing quality and consult with other members of healthcare team for a better patient health outcome. Your med lab sci is also involved in monitoring disease and treatment progression, and some medical laboratory scientists, especially those who are working in reference research laboratories, they help develop vaccines. So now let's discuss the role of MLS in the COVID-19 pandemic. So the role of MLS in the fight against COVID-19 include but not limited to diagnosis, monitoring, confirmation of recovery, safety and efficacy testing of broad-spectrum antiviral agents, vaccine discovery and development, as I've mentioned earlier, validation of testing protocol and kits. They also offer, I think sa ibang bansa, they offer advisories to guide government policy on containment, and they are also health advocates.
So mas ano siya sir, no, more, or should I say it's comprehensive pag siguro lahat ng ito is ano napapractice talaga in the country. But I believe so. Is there like, I think meron naman kayong ano no, yung parang sort of a union or ano bang tawag dyan, organization na what do you call it nga, medtech?
PAMET, sir, PAMET. The Philippine
It's yeah,
Association for
ayun, PAMIT. Yeah, kaya nga ako no, I really trust the ano brands with PAMIT na ano na logo.
Safeguard.
Kahit ano pa yan ano. Basta may PAMIT. Ayun. So yeah. Ito na yun, health advocacy, validation of testing protocols and kits, and ayun. Alright, sige. Sir, ano ba yung mga ano siguro? Are there like releases or advisories na ginawa ng PAMIT in relation to ano siguro mga ganito mga protocols, mga testing protocols and kits? Meron ba? Is there any?
I'm sure, sir, meron, pero they were just pushed the names. Siguro the names of those who are giving advisories are no, hindi naman known. No, they really nasa background lang. And I'd like to emphasize these roles, sir, because there's a misconception that medical technologists are just involved in the collection of specimen. So taga-collect lang po sila. But when in fact that there are a lot of things to do, or ang role ng medical technologies is not just contained or limited to collection. So they actually are really involved in the diagnosis and in the prevention, the monitoring of diseases such as this, your COVID disease.
Ayun, I at least klaro na sa ano na hindi lang doon sa ano sa detection or sa diagnosis. Now, sige, go ahead po. Let's go to the diagnosis, yung sasabi mo.
Okay. So, in terms of diagnosis, sir, how our medical laboratory scientists are involved in the diagnosis is that they provide accurate and timely diagnosis. Accurate and timely diagnosis is very critical to the containment of any disease outbreak. And that is one of the roles of a medical laboratory scientist. They also have the responsibility of identifying underlying conditions such as your diabetes, yung katong ginaingon nato na comorbidities. And one of the ways that you can identify those comorbidities is through laboratory laboratory analysis. So MLS, your lab scientists are also involved in genomic sequencing. So when we say genomic sequencing, this is to distinguish the virus from other types, which is very crucial in laboratory diagnosis. So there are viruses na, especially with the current virus ng bilis mag-mutate. So MLS are the ones identifying the genomic sequence to identify a different type due to mutations. So ibang type mutation, different din ang pag-handle and different din pag-treat doon sa virus. So MLS, you're the laboratory scientists, are also the ones performing diagnostic tests such as your real-time PCR. Your real-time PCR is the gold standard diagnostic tool for COVID-19 because it detects the virus in nasal swab, throat swab, or other respiratory specimen. So, the thing about RT-PCR, sir, is because kahit gaano kaliit yung virus na sa katawan mo, your RT-PCR is able to detect that virus because the method of RT-PCR is it multiplies the virus so that it could be detected in the body. Another diagnostic tool in detecting your COVID-19 is through rapid diagnostic test kits. So these are the kits now. I think everybody's using already. I don't really know why, but there are a lot of people who sell rapid diagnostic kits that they use it at home. So I'm not really sure if they're allowed to do that, pero wala naman ako sa regulating commission to check that. So again, the difference between your real-time PCR and your COVID rapid diagnostic test is the turnaround time. So sa COVID-19 rapid diagnostic test kits, that's why it's called rapid, because it could release or yield results within 15 minutes compared to your real-time PCR na ang turnaround time is about 2 hours per sample if batch testing per batch. So that's how those are the roles of the medical laboratory scientist in the diagnosis. So another role, okay, sige. Go ahead, sir.
Yep. Sorry to butt it, pero may sinabi si Ma'am Bea Lau dito during pandemic, PAMET assist on the welfare on the medtechs. Ay, asa na ba yun? Also aids in the professional development. Kaya nga I check kasi yung yung website ng PAMET Incorporated.ph. Yung PAMET kasi they also offer CPD activities, which is good. They have ongoing webinars and all that. And they also have what strikes me the most kasi they also have publications. They have newsletters. I don't know if it's on a quarter na basis, pero PAMET Link ang pangalan. Nag-subscribe ba kayo?
In fairness with PAMET naman, sir, they have a lot of programs that support the professionals or the professionals. in terms of their career as a medical laboratory scientist. So, yun lang, na-stop siya, sir, because of the pandemic. So, they could not conduct a face-to-face na convention and a face-to-face training. So, pero they are adapting now to the virtual one.
Yeah, that's really great. Para at least may opportunities pa rin kayo to grow as professionals in your field. All right, so that's it. We have diagnosis, we have monitoring. Thank you so much, Ma'am Bella, for the share. Now, let's talk about sa role ng MLS in controlling. Asa na ba tayo? Where were we? Controlling
Monitoring.
and monitoring na pala. Okay, monitoring.
So monitoring,
Maliit.
disease monitoring is another crucial role of MLS in containing the pandemic. So it is the duty of a medical laboratory scientist to carry out tests that will assist in monitoring the disease progression as well as the prognosis of the patient after the antiviral therapy. So MLS also detect post-recovery complications that can arise in the future. So after na-treat na ni patient, through laboratory testing, we can detect the complications after the treatment. It is also very important to determine when a patient can actually be said to have recovered completely. And medical laboratory scientists play a significant role in confirming the state of recovered patient before he is allowed to reunite with the community to avoid silent spread of disease. So there are laboratory tests that can be used to ascertain that a patient has fully recovered and no longer shedding the virus after treatment, such as your viral load and your leukocyte count. So si viral load, it's the testing that determines the amount of virus in your body. While your leukocyte counts are WBC count, white blood cell count. So pag mataas yung white blood cell mo, it probably means that there is still an infection occurring in your body. So those are the tests that actually determine if the patient has fully recovered already or meron pang underlying na infection in the body. Another role of the medtechs or your laboratory scientists is through disease surveillance. So your medical technologists or medical laboratory scientists, especially those working in the epidemiology department, they conduct periodic pathogenicity and immunogenicity studies. This is to find out the emergence of new serotypes due to mutations. So yung sinabi ko, sir, na the virus can actually mutate and produce another type. So that's part of the disease surveillance na ginagawa ng mga medtech. And also they monitor the development of herd immunity. I think we already are very common with the words herd immunity because that's the goal.
Yes, sir. Yep, yes, sir. Pero yung tanong, when can we say that we have achieved yung herd immunity?
A good
Kasi
thing
yeah, based on on general description or definition of that term is yung when a large portion of community becomes immune to a disease. But when or how can we say that, or kailan natin masabi na nahit na natin yung large community or population in a certain community? Is it 70%, 75%? Is there such a figure?
Yes, sir. Good thing you asked about the herd immunity because the term herd immunity refers to the fact that the risk of infection among susceptible individuals, when we say susceptible individuals, these are unvaccinated individuals. So the risk of infection among susceptible individuals in a population is reduced by the presence of adequate numbers of immune individuals. So gaano ka rami dapat ang immune individuals to achieve herd immunity? So basically, it's 70% to 80%, sir. So that's
Great.
the time that we can say na we already achieved a herd immunity.
Great. Sige. Let me do a quick check, sir, ha, kung sa kung where are we na ba ngayon? Kasi parang overwhelming masyado yung figures ni Ma'am Bea Lau sa ating previous na episode. Hindi ko natandaan where are we na talaga sa ating but do you have the update kung asa na ba tayo? Is it nasa 50% na ba tayo ngayon or teka lang, i-check ko. Latest sige, go ahead. We have over 60 million, right? Tama ba? Yeah, 60.1 with 129 million doses given. That's about, sir, 54.9. So, yeah, we're more than halfway there.
Yeah, malapit na. I'm really, I want to really emphasize the vaccines work, and this is the only way we can end this pandemic is through vaccines. So, pa-vaccine na mo, guys.
Yeah, and you know what, sir? No, it's great to know. Looking at the table of figures from different countries, it's good to know that China, where this all started, I think they have already achieved more than the desired percentage, because they have achieved 87%. That's 3 billion.
Wow. I think, sir, really the factors that will determine the factors that will determine that we can achieve herd immunity is with the vaccine supply, and also the acceptance of the people who will participate and will allow themselves to be vaccinated. So those, medyo may problema tayo dun sa latter, sir, those people. I think vaccine supply is not an issue. I think not an issue anymore, because there are a lot of vaccines already available. Pero yung issue natin, sir, is about the people who are willing to get vaccinated, because there are still a lot of misconceptions about vaccine. That is why medyo malabo pa rin yung herd immunity. I hope by the end of the year we can achieve it already, para back to normal na ta.
Lagi, sir. We all look forward to that. Yeah. Anyway, all right. Sige, let's now talk about the control of any disease outbreak pertaining to the role of MLS in the COVID-19 pandemic.
Oh, so another role of the MLS in the COVID-19 pandemic is the control of any disease outbreak. Sabi nga nila, the control of another pandemic. So the medtechs are involved in stopping another pandemic. So beyond diagnosis and monitoring, the medical laboratory scientists also play a vital role in the control of any disease outbreak. They are involved in all aspects of infection control program, may it be in the community or hospital's infection surveillance system. So the medtechs, they support infection control program to effectively and efficiently use laboratory services for epidemiologic purposes by providing support for sterilization and disinfection of the facility. They also test hospital personnel for possible infection. They provide advice on specimen collection, transport, and handling, and they put plans for containment of all specimens that has been sent to the laboratory for analysis. So MLS, I think I've mentioned this earlier. MLS working in research laboratories, they are involved in helping develop vaccine against COVID. So continuous pa din ang study and study about the treatment and vaccine development. Also, the medtechs working in reference laboratories, they're the ones validating the effectiveness and performance of rapid diagnostic test kits. So, which is really important, so that the detection of the virus is really accurate and para tama yung nire-release na result ng rapid test kit.
All right, I see, sir. I just want to share with you. I've been following. I think it was just yesterday that I I followed a YouTuber na medtech professional so that I also can in one way or another somehow relate to the to the medical technology world. At least at least unti-unti ko siyang ma-observe and that I can participate in the discourse. Ano kasi yun she mentioned yung yung what is that again? MT it's not law, but I think bioethics, if I'm not mistaken, if my memory serves me right. Ano ba yung guidelines or principles ng ng medical technology ethics or whatever you call it, bioethics in regard sa sa pagsa-study ng, for example, for the development of yung research for the research labs. Ano ba yung guidelines or principles in developing vaccines, ganito ganyan? I'd like to to ask specifically on yung sir, yung subject. Ano ba yung ginagamit? Is it really an SOP or standard operating procedure na i-test mo na talaga sa hayop bago sa tao?
Yes, sir. It's under the research program. So before a vaccine or before a medicine, let's say a medicine can be administered to a human, it must be first tested sa hayop. So that's part of the bioethics. So it will be deemed unethical if i-test mo agad yun sa human. There are no human trials na gina-allow na ng there's a committee for that, the bioethics committee. So they do not really allow a human trial na karon unless may na-produce na results on animals.
I see. What particular animals are subject to trials?
Usually no. Sa laboratory, sir, for small mga as big to begin with sa rats like mice.
Mm-hmm. I see.
But I have read somewhere na may testing
Pero meron
sila
ding baboy
unggoy.
Unggoy. May narinig din akong sa baboy eh.
The transplant.
Ayun pala. Okay. Yun pala yun. All right, sige. Anyway, kasi na-mention niya kasi yun sa latest na vlog niya. Anyway, sige. Ito, validate effectiveness and performance of the rapid diagnostic test kits. Ayan. So basically, sir, halimbawa, ito praktikalin na tanong kasi para at least we can also bridge the gap sa mga pinag-uusapan natin to what we can observe, we hear over the radio, we watch on TV sa mga balita. Yung bang paglapag ng ng mga virus galing sa ibang bansa, may doon, may participation doon may role doon ang PAMET or ang mga medical technologies. Do they para ba silang yung taga quarantine ng prutas kumbaga sa Pilipinas? Dumadaan ba yun sa kanila for let us say quality assurance check or parang ganun?
I think, sir, the role of the PAMET is more on the human transmission. So for the inanimate objects, my other body for that, governing that, to regulate the entry of the stuff that came from other countries. So more on sa PAMET and other medical organizations, they are more concerned on the human to human transmission. So I'm sure there are a lot of medical professional or organizing or medical organizations na advise the government about those travel bans and really to close the borders of the Philippines to prevent the spread of the virus, especially from different country to the Philippines.
All right, great. Now, sir, teka lang. May kasi tayo, may questions tayo na sinend sa atin. Sige, let's pave the way for these questions before we come to a close. Alright, pwede ba natin ipakita yung questions po natin? Yeah, nasinend sa ating inbox. First, alright. How do healthcare providers rely and trust lab test results?
Oh, so I think the question is, how do healthcare providers release reliable and trusted lab test results? So there are methods that we checked, specifically our machines, before we run patient samples on them. So that's called your quality control. So if that quality control passed on that machine, it means that our equipment are working very well and are releasing a very accurate and reliable and precise na results. So that's how we check if the results that we are releasing are right, are correct, and are good results, or are results that are really reflective of that patient samples.
Ayun. So it's through the use of equipment, medical, equipment. Another question, there is news that COVID is becoming endemic. Is this a sign that the situation is improving?
Theoretically, if ang pandemic has been demoted demoted to an endemic one, that I haven't read a reliable news source that it's becoming an endemic. Pero that's a good sign. When you say endemic, it is localized. The disease is localized in a certain area instead of being in a worldwide na concern. So if a pandemic has been reduced to an endemic, it's a good sign for the world. At least mas concentrated na doon ang focus ng World Health Organization or CDC to that certain area, compared to i-address nila yung concern on a worldwide na basis, or na infection.
Ayun. All right. I think that would be all for the questions. Sir, and finally, I think we still have one last slide. Okay.
Yes.
Yep. Okay.
Okay, so for final words, sir. This is from an article that I've read. So he said, or the author said, that it is important for the medical laboratory scientists to be regarded as professionals in their own right by patients, other cooperating parties in the healthcare system, and by the government. So more on be inclusive. Like there are still healthcare professionals there na in the hospital settings are not recognized enough for their efforts because some other professionals are being highlighted. And I'm not against that. They deserve to be recognized. It's just that also na there are also other people who are working in the background. You may not see them at the front line, pero they are as well as important as those who are at the front line.
Yep. And I can liken that to parang sa pagde-develop ng web. May front end, may back end, di ba?
Yeah.
Yung na-appreciate lang natin yung yung mga nakikita natin, yung design, the text. But
The
all the
interface.
works, the nitty-gritty, nasa likod yun. So, it's really great to also show off, or to show our hats off to those who are working in the background. So, ayun. Grabe. Sir Ray, that has been a very, health, a loaded discussion with you sa ating, let's wait for, baka may questions pa yung ating audience. But I think it's really, clear naman, crystal clear yung ating discussion. Really, thank you so much for joining us sa ating MedTech Hour. And I think, Sir Ray, we're going to have parang a continuation on this series. We will still be talking about COVID-19 series sa ating MedTech Hour program. Sige. Let's wait, baka may mga pahabol pa sila na question. Ayon. So again, just to wrap it up, in this episode, we talked about the history of COVID-19 pandemic. Ulit-ulit natin yung pinag-uusapan sa ating episodes sa MedTech Hour so that maano talaga natin ma-internalize how it all started, how it's going on. And then we also talked about the etiology of the pandemic. Tama, sir, no? Etiology. And then the transmission of COVID-19 virus and the definition of MLS or medical laboratory scientist. To those who would like to consider to be, a medical, ano bang term yan, sir? Medical laboratory or medical technology professional, siguro? Medtech, ano ba yan? Medtech professional. To those who would like to be a medical technology professionals in the future, you should consider taking
enrolling
medtech at the JMCFI. Yep, because we provide you with programs such as this so that you can better enhance your medical technology professional education prior to practicing your profession or your job. And finally, of course, we also talked about the role of MLS, medical laboratory scientists, in COVID-19 pandemic. All right, thank you so much, Sir Ray Gomez, ayan, our faculty from the medical technology program. That has been an hour of healthy discussion in our show. This is your Wednesday Habit, a show where we delve into technologies that diagnose, treat, and improve a person's health and well-being. Once again, Sir Ray, thank you so much for joining us in the show. Really, thank you for the shares. And to all our MedTech, our friends and family, I hope to see you in our next one. Goodbye, everybody. Stay safe. Huwag kalimutan, yun, hugas, punas, social distancing, and all the, yep.
Get vaccinated,
The-
sir. Get vaccinated.
Yep, get vaccinated as soon as possible so that mahit na natin yung herd immunity. All right, once again, this has been Lord Vincent Van Mendoza, the head of training and development of a JMCFI, saying thank you so much. Enjoy the rest of your day. Thank you so much. Until next time, goodbye.